Well, good afternoon. Hope everybody's doing well today. You know, on Friday afternoon, there was a city executive order issued, which had a curfew involved. There was also the governor's stay-at-home order. At this time, to bring clarity to that, I want to announce that we'll be working with the City Council between now and actually the City Council meeting tomorrow in order to, first off, they need to adopt the governor's stay-at-home order so that it can be enforced. Secondly, they need to adopt the executive order by the mayor so that the curfew can be enforced. And third, they need to have part of that ordinance address the Mobile Police Department's ability to write tickets for those who are in violation of the curfew. So I'm pretty sure that they understand the sense of urgency regarding that and that they'll be able to do the things that are necessary. Really, at the end of the day, it's all about enforcing the curfew. It's come to my attention, though, over the weekend that we have many people who are at home or in small businesses who are making their own masks to be used, some of them to be given away to our public health officials, others to be used in places of business. So therefore, because those masks are a critical need item, we are saying that these fabric stores are now essential businesses. So that's a change from what we have said in the past. I would also say that in asking me or anyone at the podium whether a certain business has the right to stay open or will it be closed, we're going to every time refer you to the frequently asked questions because I don't want to say something from the podium that will then refute something that we've already answered in the frequently asked questions. And if it's not answered in the frequently asked questions, we'll put it there and we will get you the answer. The second thing is that even after the ordinance, after the executive order Friday afternoon and following the governor's stay-at-home order, we found it necessary, based on feedback we were getting with the big box stores, to further reduce that to a 20% occupancy. And that was really based on what we were visually seeing and the feedback we were getting from the public. And that's exactly what we said we would do, is that if we didn't see the results that we wanted, we would change that number. Having been to two big boxes this morning, Sam's Warehouse and to Target, and based on what our feedback was over the weekend, I really believe that all of our stores, our grocery stores, our big boxes, everybody is doing what they need to do in order to assure your safety and your health should you choose or should you have to go shopping. To me, it's very, very impressive. And I'll just give you one example. In visiting Target this morning, they made the comment that every 30 minutes that they come on the loudspeaker and they warn all of their shoppers to maintain that 6-foot spacing. So anyway, tremendously grateful for that because it helps us ensure your safety. You heard also Airbus make their announcement that they're pausing production. You know, that's exactly the kind of thought process that other businesses are going through right now. Airbus recognized that their supply chain has become fragmented, and it doesn't make sense at this point in time just to continue to pump out airplanes or produce airplanes when probably it's more prudent at this time to take a pause. And I think that the way they are handling it is very commendable, and that they will continue to pay their employees. Not every company can do that. But anyway, we're grateful to have a corporate company like Airbus do the things that they're doing, not just for their employees, but for the community also. This morning, I was at Ladd Stadium at about 8:20, 8:30 or so. There were already cars in line, as we predicted several weeks ago when the owner of Synergy Labs said he hoped to be up, and really it was around the 1st of April. He was just a few days off, but he is up and running, and I think things are going well there. And so Director Barber will talk about some more details having to do that, possibly with the ticketing having to do with the curfew, But at this time, I would ask didn't I see Dr.? Yep, Dr. Laura Cepeda. If you're not ready, Doctor, I can call on Jim Barber first. You good? Okay. So Dr. Cepeda will give us an update from the Mobile County Department of Health.
Good afternoon, everybody. I'm here with your regular update. So just to let you know, the state of Alabama stands at just under 2,000 cases right now of coronavirus. Mobile is at 143 cases and Baldwin County is at 37. For the state of Alabama, we are at 47 reported deaths with 32 confirmed deaths. They continue to investigate each death and make sure that it is attributable to COVID-19. Alabama now has confirmed cases of coronavirus in every county except Geneva. I just want to take a moment as we think about all the people who are working so hard to keep us safe, and that's everybody who's staying at home and doing all the things that the mayor and the governor and the health officers are asking us to do. But some of the people that just don't ever get any commendations are the emergency preparedness people and our emergency management people, and I have been working with them a lot, and I just really want to say thank you to all of them. They work so hard all the time just to be ready for something like this, but they really work around the clock 7 days a week when something like this happens. But their job is to make this as seamless as possible and to keep the hospitals and all the facilities able to work just with as little interruption as possible. But they don't wear a special uniform for the most part, and they really get no attention at all. But they do so much to make something like this have as little interruption as possible to our normal activities. So I just wanted to say thank you to them. You probably noticed that there's a new recommendation or a suggestion. It's not that strong of a recommendation to wear masks. Everyone wear masks when you're out, and that has come from the just noticing that there are a lot of asymptomatic and pre-symptomatic cases, and that's when you see a lot of transmission is in those a couple of days, especially when you are pre-symptomatic. So that's where that recommendation is coming from. So it's something you could consider. It's not a very strong one. But if you have those masks available, those would be those cloth masks, not the masks to take them from a healthcare worker, please. But if you do have any homemade cloth masks, that would be a great time to use those. But keep up your hand washing. Stay at home. Don't use those masks if you don't need them. Please stay at home. Keep up your hand washing. And thank you, everybody. Thank you, Mayor.
So at this time, we'll ask Director Barber to come make his report.
Thank you, Mayor. Just a report on Ladd Stadium's progress. It is up and running. The public hotline is active. They have been receiving calls a day. You'll see most of those appointments take place from the general public probably tomorrow. To update you a little bit on the testing of first responders for the COVID-19 antibody, we had a total of 37 first responders that were tested with positive for the COVID-19 antibody. Now, this is the antibody test. And so 13 of the Mobile Fire Rescue Department tested positive for the antibody. 3 of those have been tested through the PCR or the nasal test and have negative active virus within their system, so they have been returned to work. We do have 1 positive COVID-19 firefighter who has been quarantined, and he is asymptomatic, and it was a result of the antibody test. We have 24 Mobile police officers that tested positive on the antibody test, but we had 6 return negative on the PCR or the nasal swab. 2 did come back positive COVID-19, and of those 2, both of them showed some symptoms at the time the test was given. I want to remind everybody that the PCR test is the test that checks for the active virus. The antibody just tests on whether or not you may have previously had that virus. I did want to make some comments about these uncertain times and how we in uncertain times tend to look to our elected leaders, you know, for some certainty that we would get through this with some stage. And last night I was watching the news, and like many of you, you see all this grim and very dark reporting going on in our country, the lack of PPE. You know, you see these hospital workers that are interviewed, they're obviously stressed out, they're very exhausted, the lack of ventilators, the hospital's hitting capacity. So very grim things. So I was discussing this with my wife, and she decided to play a song for me called Break Every Chain by Tasha Cobbs. And at the end of that, I realized that we tend to overlook this beacon of light in the darkness that we see happening every day. And what that is that we understand that the president can't fix this problem. The governors can't fix this problem, and it's not going to be fixed by the Democrats nor the Republicans. What is going to fix this problem is an army rising up by our medical providers. It's the doctors, the nurses, the first responders that are out on that front line, just like I was reading some of those exposure cases. And you know, this is an army that might be short on material, but I can assure you they are not short on their resolve to defeat this virus. And they have the courage to fight a virus, an enemy that they can't even see. And they have the strength to fight an enemy that does not rest. So people come to me all the time and they ask, what is it that we can do to help y'all? Well, you can follow the rules that are set out by our elected officials. That is one. The other thing is that whenever you see that uniform, or you see that lab coat, or you see those scrubs, take a few seconds of your time to say thank you. Thank you for a grateful community. Thank you from a very grateful nation. And I assure you, these professionals are the ones that will fix this problem, and I am confident they're going to fix it a lot sooner than a lot of people think. Thank you.
Thank you for those words of encouragement, Director Barber. That's exactly right. There are a lot of people that believe that, but it doesn't help to remind them. At this time, Dan Emery, who is the president of Feeding the Coast, is going to make a report. And all of us are doing things differently. All of us are having to do more than what we thought we could do. But I can't imagine what the individuals and the people who have been working at Feeding the Coast, what they've had to do with the additional burden that's been placed upon them. So, Dan?
Thanks, Mr. Mayor, for giving me the podium. My folks at Feeding the Gulf Coast, they're the heroes, along with the firefighters and the policemen of this particular crisis. They're working longer hours than ever before. I get there at 6 and I leave at like 8 o'clock at night, and there's people there 2 hours before I get there, and I'm the last one out, but pretty much everybody's working their hearts out. Kind of how we gauge what is demand, and we know demand is way, way up. Our website traffic is up 900%. And we're an organization, we serve about 600,000 meals a year, and we have about 53,000 families that we service in our 25,000 square mile service area. But we're dramatically up, and we're doing everything we can to satisfy the need of the public. And it's a very unusual thing, because you got people just 2 or 3 weeks ago, they were normal professionals driving Mercedes, and you go to these outdoor pantries and they show up in a Mercedes or an Armada or whatever, and here we are, you know, putting food in their car. But that's what we're here for, and we're glad to help. And any help you can give us, or if you need help, come to our website at feedingthegulfcoast.org, and we can either help you or we can take a donation, and that's what we're here for.
Okay, at this time I'll be glad to answer any questions that anyone may have.
You mentioned Synergy Labs. How many test kits do you have?
The question is, how many test kits does the city have access to from Synergy Labs? And I think it's going to Huh? 10,000 is the number. Yeah. And not not sure the exact time frame before they have, how many they're adding on a daily basis. That would be a question for them. Have we identified any new hotspots? Are you speaking of in Mobile County? I would have to ask Dr. Cepeda if she knows, is there a hotspot that's been identified in Mobile County? Specifically, no, there is not one. Don't have that information. We probably have that information. We haven't looked it up in that specific manner yet. Okay?
This would be a question for Dr. Cepeda.
Yeah, Dr. Cepeda.
Number Governor Ivey said on Friday that there have been multiple deaths and lots of several outbreaks in nursing home facilities, she specifically said nursing home facilities. You guys were referring to as long-term care facilities.
Yes.
Is there any? You guys said that you guys were looking at one specific one with at least one patient. Has anyone tested positive at any of these facilities? Is there an outbreak in any in Mobile County to your knowledge at this point?
We have
Deaths reported at them?
no deaths reported at the facilities, no. There have been some patients with some respiratory illnesses at a couple of long-term care facilities within Mobile County.
Are any of them confirmed COVID-19 related?
There have been some hospital testing, COVID-19 positive. Yes.
So there's some confirmed.
Yes.
Is there any, you guys said, what was it, last week at one point that you guys were looking at because there was one case at one. Is there more than one case at some of these facilities?
Oh, I'm sorry. The question is about long-term care facilities and cases of COVID-19 at long-term care facilities in Mobile specifically. So we're investigating a couple of cases of COVID-19 in long-term care facilities in Mobile County. And so we treat each case, we investigate it as an outbreak because of the circumstances within a long-term care facility. Everyone lives in a fairly close proximity, and so you treat it as an outbreak even if there's just one patient. So.
If there is a significant outbreak, would one of them be shut down, a specific location, or how does that work? Has the county decided that, how that was going to work?
Every episode is different. Every long-term care facility is different. So every investigation and treatment plan is different. So there's no blanket plan. It just depends on what happens and what the facility is. We make a plan for everyone that's different.
Dr. Cepeda,
Yes.
every day the state and the county give us numbers of hospitalizations.
Yes.
Statewide and in the area. I've asked, so I know you guys can't tell us how long or when somebody gets out of the hospital if they're listed as hospitalized. Could you give us an idea of what the average hospitalization is for a COVID-19 patient?
Okay, so the question is, what is the average hospitalization? And we have kind of national numbers, I think, and maybe some international numbers, and to the best of my knowledge, it's somewhere between 10 to 18 days. I would say don't quote me on that, but I think that's exactly what you're going to do. But yeah, so I don't have local numbers for the hospitals because we don't have that many numbers of discharged patients yet. We're at the beginning of this really for our hospitals, and so we don't have enough data for discharged patients to really create a good average, basically to create a good database for that, if that makes sense. Okay, great.
I have a question for response for police.
Okay, can I just make one more statement? We are getting a lot of calls and questions with a lot of people, losing their jobs and their insurance, but just about applying for Medicaid. And you can now do that online, and the process for doing that is available on our Facebook page, on Mobile County Health Department's Facebook page. So you can go there and find out how to do that as well. But you can now do that online. Thank you.
I was curious about, we were hearing a lot on the scanner over the weekend, Signal 99. Is that COVID related?
The question was that they're hearing over their scanners the Signal 99 call. What that is, it's a medical emergency involving a possible infectious disease. And so we've got somebody that's presenting with symptoms that are similar to COVID, but there has been no confirmation that it is COVID. But those runs by paramedics require that they wear shields, masks, the garments over their clothing, and that they glove up. So they're in full PPE when they go to those Signal 99 calls.
How many were there over the weekend from Friday until now? Do you have that number?
Now, I think we told you there were 38 last week. I do not have the numbers as of over the weekend, but we'll certainly track that so we can give you a weekly update on how those are tracking. We did tell you they have been tracking up.
So it wouldn't be a surprise if you see the numbers and they were way higher than what they were on Friday.
That's correct.
Okay.
You know, we haven't mapped them. And again, these are not necessarily confirmed COVID cases. So there's a lot of respiratory illness out there that are non-COVID. We're seeing more of that than we are the COVID-19, but we're treating them as if they are COVID related because of the symptoms are very similar.
Have you guys made any thoughts to the fact of making masks mandatory for uniformed officers? Pensacola police have done that for anyone who comes into contact with citizens like that. I guess it would be a Signal 99 with police officers who show up, or possibly is it mandatory for them to wear masks?
Whenever the question is, if a police officer goes to the Signal 99 call, would he mask up and glove up? The answer to that is yes, absolutely. Anytime that we come in contact with somebody that presents with an infectious illness, we certainly are, all officers are equipped with the PPE to do that. But the actual hands-on medical care will come from either our paramedics or ambulance attendants.
You said 24 tested positive for the antibody test for police.
That's correct.
What was the breakdown on the positive for the PCR?
The question was, out of the 24 MPD officers that tested positive, what was the breakdown on the PCR test, which is the nasal test? 6 negative COVID-19, which means that there is no active virus. 2 positive COVID-19, which means they do have the active virus and are now quarantined.
Were they asymptomatic?
These were symptomatic. The question was, were they symptomatic or asymptomatic? These 2 did present with symptoms. The firefighter that was positive COVID-19 was asymptomatic, had no symptoms.
What happened? I mean, we not have the result on the other nasal tests for the 24 officers. You mentioned 8, but you were negative positive. What about the other 16?
We are still awaiting for the PCR test to come in on the rest of the remaining COVID antibody positives.
Okay. Same with the firefighter test.
That's correct.
Any idea when they come in?
The question is, any idea when we would know the rest of them? You can see it took us a week to get to where we are, but we do think that we should have most of the results done by the end of this week.
You guys tested all first responders now?
Mobile PD and Mobile Fire, I would say, are 90 to 95% completed on testing. And so, but you still have many other first responders in our area from other agencies and cities and counties that still are in need of testing.
How many tests have you given out to MPD fire so far? I get over 800?
Yes, I think we're around 900 tests have been done.
I have a question for the mayor.
Okay.
You mentioned about the fact that the city council needs to adopt the governor's stay-at-home order and your executive order so that MPD can enforce the curfew. Are you saying that it was not illegal they could do nothing over the weekend during this, police, to enforce this?
They wouldn't have had the authority to write a ticket. No, there was nothing to keep them from approaching somebody and asking them to disband or do something differently. But they did not have the ticket writing authority that be required by the city council.
So this would have been viewed as more of a
warning. Absolutely, been a warning period. Yes.
So,
but we had to get the cart, the horse before the cart, and that meant we had to do the order first and then the ordinance.
But shouldn't the city council have maybe come in over the weekend to try to stop or that day to try to get
there was really no way to get the city council. I mean, tomorrow's meeting would be the first meeting where they will do everything by calling in, and I don't think it would have worked over the weekend.
So do you believe that?
And also, they have to give a 24-hour notice, I think, if there's going to be a public meeting, so that just wasn't going to happen.
Do you believe so mobile police officers most likely are going to have that ability, say, tomorrow night to give out those citations?
Yes. And if you probably won't remember this, but it was about 3 years ago that we adopted an ordinance called the UNTC, yeah, and that enabled them to write tickets for minor offenses that we didn't want them to have to bring people, to jail. That they could give them a ticket and handle it that way. This is the same thing. We don't want policemen to be engaged in putting somebody in the car, having to bring them to jail, check in the jail, go to court. We're trying to cut through all that. If you're a violation of the curfew, you're going to get a ticket and you have an option of paying it, or you're going to go to court. If you go to court, it's going to cost you a whole lot more than if you pay the fine.
I was expecting on a Monday after the stay-at-home order not to see a lot of people out and about. I would say it was any typical Monday out driving to work today to be here for this press conference. Are people not heeding that warning? I know there are a lot of exemptions there where people can go to the grocery store, go to certain religious services as long as they're under 10 people. They can go to outdoor activities. It just seems like business as usual. Is that a concern for something like this?
Your remark is that it seems like it's business as usual, depending on based on the amount of traffic that you're seeing. Well, when I rode through the malls this morning, and between both malls there were less than 100 cars in front of them, and there were no cars in front of many of the strip malls, I'll say it's anything but business as usual. There are exceptions for people to be able to be out there. There are business exceptions, and there are exceptions for individuals. And so they fall into a category that's either been deemed by the governor or by the mayor as essential. And so at this point in time, it is what it is, but if we find out that we need to do something differently, we will do something differently, just like we did when we ratcheted down the amount of the number of people that could be in a big box store.
And what would be the typical, I know you said 20% is now you guys are reducing to 20%. What would be, say, a normal grocery store is about 40,000 square feet. Home Depot is limiting to 100 people in most of their stores nationwide. These numbers, that's still pretty high for some stores to be limited to 20%. Are you guys hopeful that this is going to help?
When it comes to the big box stores and the mega stores, I believe that over the weekend what we did is going to put the right number of customers in there so that they can have the proper social distancing. When it comes to some of the smaller grocery stores, whether the number of 40% is still applicable, at this point in time, we haven't had, a bunch of registered complaints that it wasn't being adhered to. If you go in those stores, you will see anywhere from 6 to 8 feet to 10 feet between where people are supposed to be standing. And at this point in time, based on the feedback we're getting, we think it's the proper percentage.
So the 20% is only going for the big box stores, not grocery stores?
That's the mega stores, which may have like a Walmart, which has a grocery store in it. But the 20% was for the mega stores.
So the 40%, I think 40% still for Publix, Winn-Dixie.
That is correct. If you're just a grocery store, that's correct. Mm-hmm.
Would you, I know you kind of touched on it at the beginning of the conference. Would you want to say anything else just in regards to Airbus and their decision today for that grocery store?
Well, again, I think it's the prudent thing to do based on all the information that they had at their disposal. We had a phone call a couple of hours before the announcement to give us a heads up exactly what it was going to be. I was actually texting the CEO of Airbus this morning at about 7 o'clock, and it was shortly after that that I had the formal notification from the local management of how it was going to impact Mobile. So I appreciate everything that everybody's doing. Just to reiterate, somebody asked me Friday what was the difference in what we had done previously to the executive order and what happened when we gave the executive order is that this is a mandatory stay at home, with the exceptions. Now, after 10 o'clock at night, there are very few exceptions. So if you're riding between 10 o'clock at night and 5 o'clock in the morning, you better have some identification on you so that you can prove that you had a reason to be out. Otherwise, you will be given a ticket. My last thing is that I can't thank the organizers enough for those that organized the lighted up mobile in the parking lots last night. People with the blinkers on and with the blinkers and flashes on, and appreciate the hospitals allowing them to do that. I also appreciate the governor making it very clear in her order that that was allowable across the state of Alabama. I think it's going to be especially meaningful this coming weekend, being Easter weekend, of how churches will handle their services. And so we've had wonderful feedback from the churches that they're grateful for the clarity of how things can be done. So thank y'all very much for being here. We'll see you tomorrow at the same time.
Is Costco considered a big box store?
Is who?
Is Costco in that mega store?
Costco yes, absolutely. Yeah.
So that's the 20%.
Yeah, Costco would be a 20%. Yep. And I think Costco was one of the leading ones on getting it right early. Thank you.